Can you raise your right hand, please? Do you solemnly swear or affirm to tell the truth, the whole truth, and nothing but the truth? So help you God.
I do.
Good afternoon, doctor. Could you state your full name for the record?
John J. Richards, MD.
And doctor, you were subpoenaed for a deposition today and asked to bring certain medical records. Did you bring any medical records with you?
No.
Okay. Okay. Can you tell me what type of medical doctor you are?
I'm a general surgeon.
And for how long have you been a general surgeon?
Practicing since 1991.
Where did you go to medical school?
Medical College of Georgia.
Do you have any type of specialty, or is general surgery considered a type of specialty?
That's considered a specialty.
Where are you licensed to practice medicine?
In the state of Florida, and I have an inactive license in Alabama.
Do you have any board certifications?
American Board of Surgery.
In connection with your practice as a general surgeon, have you had the opportunity to author any publications or literature of any sort?
No.
Do you hold any teaching positions anywhere?
No.
Have you ever held any teaching positions anywhere?
No.
Have you been a medical doctor since 1991, or were you a general surgeon since 1991?
I graduated from medical school in 1986. And then did a 5-year residency in general surgery.
Okay.
Went into private practice in 1991.
Did you also do your residency at the Medical College of Georgia?
No, I did it at a place called Caraway Methodist Medical Center in Birmingham.
Do you have any hospital privileges anywhere?
At Bay Medical Center.
How long have you held these hospital privileges?
Well, off and on since 91, but most recently since 2016, I believe.
What does that mean to have hospital privileges?
It means that you're privileged to practice your specialty in the hospital.
Do you see your private patients in the hospital, or do you see general patients that come into the hospital in connection with these hospital privileges at Bay Medical Center?
Really both.
How would you come to see members of the general public that may come into Bay Medical as opposed to your private patients that you may schedule for a procedure at Bay Medical Center?
There's a couple of ways. One is if they come into the emergency room with a problem that is surgical. If I would happen to be on call, they would call me to take care of that patient. Or if there's a patient already in the hospital that another doctor has admitted and they need a general surgeon to look at the patient, then they will consult a general surgeon.
Okay. Do you have a schedule or some sort of agreement with Bay Medical that requires you to be on call at certain points of time within the week or the month?
Yes.
What is that schedule?
It varies. For me right now, it's somewhere between 11 and 14 days a month. But right now, just during the day, not at nighttime.
We're here about an accident that happened to an individual, Michael Cooley, on November 1, 2013. Back at that time, would the schedule still have been the same, meaning you were on call 11 to 14 days in that month?
No, I can't remember how many days a month we were on call then. It probably wasn't that many. And it was a 24-hour call period for general surgery and trauma.
Can you tell me how you are currently employed? Meaning private practice or?
I have a private practice with the Florida Medical Group. And I also do contracted work with Bay Medical Center to take call.
And in your private practice with Florida Medical Group, what type of patients do you typically see?
I'm not sure you mean general surgery patients.
Okay.
I don't know what you mean by what type.
Okay. For instance, would you see a patient that comes in for high blood pressure, or would you see a patient that comes in and needs a surgery to their ruptured spleen done immediately?
Well, it's not an immediate care practice. It's more of an elective general surgery practice. Although there is the occasional patient that has high blood pressure that I may treat.
Okay. And with respect to the contracted work to take calls, by that, with Bay Medical, by that do you mean that you do the 14 to, or 11 to 14 days a month on call at the hospital?
Right.
Okay. And the work that you do at Bay Medical would be to perform surgeries?
Yes.
How long have you had your practice at Florida Medical Group?
2015.
Okay. And prior to that, how were you employed?
I was off for a while, and before that I was at the North Florida Medical Group, which was where I was employed at the time of this incident.
And so at North Florida Medical Group, were you employed full-time as a surgeon?
Yes.
And how long did you have that job?
2 years.
Did you do any fellowships in the course of your education?
No.
With respect to the subpoena for records pertaining to Mr. Cooley, were you able to obtain any medical records involving Mr. Cooley from Bay Medical Center where you treated him?
I did not request or receive any directly from the hospital.
Okay. You were provided with medical records by the plaintiff in this case. Is that accurate?
Some medical records, it wasn't the entire chart.
Okay. And were you able to review those medical records?
Yes.
Okay. And I'm going to mark those medical records, if you could give them to me, for purposes of this deposition as Exhibit 1. And these records that we've marked as Exhibit 1, were those medical records prepared by you,
What do you mean prepared by me?
dictated, handwritten?
The ones that were provided to me did not contain any of my notes or dictation.
Okay. All right. Well, then I'm going to mark as Exhibit 2 another set of records which were obtained from Bay Medical Center. Have you had an opportunity to review those medical records?
No.
Okay. Can you go ahead and review them? So I can ask you about them.
Okay?
Okay. And so, doctor, did you have an opportunity to review the medical records that are contained in exhibit number 2?
Yes.
And do you recognize those documents?
I recognize them as being a chart on this patient, if that's what you mean.
Yes, okay. And so by chart on this patient, you recognize them as medical records pertaining to Michael Cooley?
Yes.
Okay. And do you recognize these medical records as medical records from Bay Medical Center?
Yes.
Okay. And in those documents marked as exhibit number 2, do you recognize documents that were authored or dictated by yourself at Bay Medical Center?
Yes.
Okay. And those documents, doctor, were they made at or near the time that Mr. Cooley was treated at Bay Medical Center by you and other doctors?
Yes.
Okay. And these medical records, doctor, were they made at or near the time that they were recorded or transcribed?
Yes.
Okay. And were those medical records kept in the course of regular conducted business activity at Bay Medical Center and in the course of your being a general surgeon?
Yes.
Okay. I want to then talk to you about how you came to know Mr. Cooley. Can you tell me the first occasion that you met Mr. Cooley?
I'm not sure what time it was, that I actually first saw him. I dictated a history and physical on him on November 1st, 2013 at 17:32.
Okay, which is about 4:32 p.m. in the afternoon?
5:32.
5:32. Okay. And how did Mr. Cooley present to Bay Medical Center?
According to these records, he was brought in by EMS.
Okay. And when he reported to Bay Medical Center, how is it that you came to treat him?
I was on call for trauma, so I was alerted.
Okay. And when you first saw him, you earlier said you took a medical history. What was the medical history that was provided?
It was a history of the present problem, also history of past medical problems, past surgical problems, allergies, social history, reveals systems.
Okay. What was your understanding of his present problem?
According to what I put in this history and physical, he was brought in as a trauma alert after suffering an injury at the shipyard where some very heavy copper plates slid off from where they were sitting and essentially slid on top of him, causing what appeared to be a crush injury to his head, possibly neck, possibly chest.
Okay. And as far as his past medical history, what history did you obtain?
That he had a history of hypertension, although he had stopped taking his medicine because he thought his blood pressure was running too low. He also had history of chronic lower back pain. Otherwise, none was given that I noted.
Okay. And did you take a social history from him? And if so, what did that reveal?
That revealed that he was a smoker, and he reported that he drank some alcohol primarily on the weekends.
Okay. And did you also do a physical examination when you saw him on 11/1/2013?
Yes,
Okay, and what did that reveal?
he was awake, alert, oriented, and appropriate. He was cooperative and pleasant. He had an obvious avulsion of the right external ear at the scalp level. He had smaller lacerations on the right side of the face. He complained of some blurriness in his right eye, although he could distinguish two fingers. There's no obvious eye trauma, no obvious facial fractures. There was some question about the nasal bone due to some tenderness. He had some tenderness over his cervical spine posteriorly. No obvious defects there. He appeared to have possibly dislocation of the left shoulder.
Okay. In connection with your review of Mr. Cooley's current problems, past medical history, and your physical examination, did you make any assessments or recommend or provide any opinions on 11/1/2013?
My assessment at the time was that he had an avulsion of the right ear that appeared to be secondary to some sort of heavy metal shearing or crush type injury. There was also the possibility of facial lacerations, closed head injury, blunt chest trauma, spinal trauma.
Okay. After your initial consult with Mr. Cooley, did you recommend or refer him to do any sort of tests?
Yes.
What type?
He had a CAT scan of the head, the face, the neck, cervical spine, thoracic spine, lumbar spine, chest, and abdomen.
Okay. And do you know whether you referred him or recommended that he undergo blood work?
Yes.
Okay. What's the reason for your ordering blood work on a patient that has come in for trauma?
There's multiple reasons. You have to see if there's any indication of bleeding. Any indication of chronic disease, blood clotting problems. We also do alcohol screening, drug screening.
Okay.
Those are primarily the ones.
Okay. Did you review any of the tests and the blood work that was ordered on Mr. Cooley?
There was some included in these records. Do you know where they are in here, so I'll have to flip around.
Maybe not. Well, I'll turn your attention to, if you look at the bottom, 03463, which is the blood work results.
Okay.
Okay. Can you tell me, doctor, whether you obtained and reviewed the results of Mr. Cooley's blood work
Yes.
that you ordered on that day?
Yes.
Okay. And can you tell me what the results were of the blood work with respect to whether or not there was any alcohol in Mr. Cooley's system?
A blood specimen drawn on November 1st at 4:05 p.m. revealed an ethyl alcohol level of 0.254.
And what is the significance of that reading? What does that mean?
That's obviously very high reading.
And when you say high reading, are you aware of what the legal limit is for someone that is under the influence of alcohol?
It's 0.08.
And 0.08 means that a person is in what state, mental state?
Well, according to
Legally.
the law, from what I understand, it means that, say, a driver is impaired.
Okay. And if, for example, an individual like Mr. Cooley had a blood alcohol level of 0.254, what does that signify?
That his blood alcohol level was significantly higher than that.
So would he have been legally intoxicated or impaired?
Legally, yes. As far as I understand the law.
Okay. In the course of your practice, do you have occasion to review blood tests similar to the one done on Mr. Cooley to determine the level of alcohol in someone's blood?
Yes.
Okay. And would a person with a alcohol level of 0.254 be legally able to drive a car?
No.
Okay. If someone had a blood alcohol level of 0.254, approximately how many drinks would they have had to have?
I really don't know.
Okay.
Am I causing noise by hitting this cord? Okay.
Or her hair just.
Oh, sorry. Okay. And this blood alcohol, well, not blood alcohol, this blood test that you ran, doctor, you were obviously able to review all the different results contained in this report?
Yes.
Okay. Was this report prepared by a toxicologist or was it prepared by yourself?
The toxicologist.
Okay. And was there any type of drug or other medication reflected in Mr. Cooley's blood work on November 1, 2013, when this blood test was taken at 4:05 p.m.?
I don't see any results of any other blood tests as far as alcohol and drugs.
Okay. Doctor, are you aware how long alcohol stays in one's body to have a reading of a blood alcohol content of 0.254?
Well, it would depend on where you started and how long it had been since the last drink, so it's really hard to say.
Okay. All right. in layman's terms, would you consider an individual like Mr. Cooley, who had a blood alcohol content of 0.254, to be drunk?
Objection form.
In general, yes. However, drunk is kind of a subjective term. And in a person who chronically uses alcohol, in large amounts especially, they may not be so impaired at a higher level of blood alcohol than someone who doesn't drink, who has several drinks. I don't know what his history of chronic alcohol use was, so I don't know whether he would appear drunk or not. But in general, with the blood alcohol of that, yes, they'd be considered drunk.
Okay. And Judge, sorry, not Judge, Doctor, could Mr. Cooley have had this blood alcohol level at 4:05 p.m. Without having a drink that day?
I would say no.
Okay. So if he had had a drink the evening before on the October 31st and didn't have a drink that entire day of November 1, he could not have had this blood alcohol content.
I wouldn't think so, but I'm no expert on that.
Okay. You would presume that to have a blood alcohol content of 0.25 at 4:05 p.m. in the day, one would have had to have more than one drink that day.
I would think so.
Did you make the determination to admit Mr. Cooley on November 1, 2013?
Yes,
Okay. And did you refer Mr. Cooley to any other doctors for additional medical treatment?
yes.
And who did you refer him to, if you recall?
Dr. Nunnery, who is a plastic surgeon.
Okay. And did you ultimately perform any surgeries on Mr. Cooley?
I did not. Dr. Nunnery did.
Okay. And did you refer Mr. Cooley to Dr. Nunnery based on the type of injury to the ear?
And the facial injuries also.
Okay. Did you have the opportunity to see Mr. Cooley again on November 2nd?
Do you have a page with one of my notes on it?
I may.
I see a note from myself on the 2nd.
Okay. And can you tell me what, if anything, you did with respect to treatment for Mr. Cooley on that day?
That was the day that Dr. Nunnery was to take him to the operating room for repair of whatever he could repair, and we also did some further x-rays.
Okay. And what type of x-rays were performed?
Some cervical spine, what's called flexion and extension x-rays to make sure the cervical spine was not injured.
And those x-rays and all the diagnostics that you recommended Mr. Cooley undergo, those were read by a radiologist at Bay Medical Center, correct?
Yes, yes.
Do you know whether you had the opportunity to see Mr. Cooley on November 4th? On November 3rd, sorry.
Third. Yes, I did.
Okay, and on that day, what were your observations?
That Dr. Nunnery had seen him and assessed his wounds and made sure that he was recovering from his operation. My assessment was that he looked good and there were no new problems.
Okay. And did you have the opportunity to see Mr. Cooley again on November 4th?
He was seen by both our nurse practitioner who does trauma work with us and also myself.
Okay. And what were your impressions on that day?
That he was doing well, and as soon as Dr. Nunnery was ready, we could discharge the patient home.
Okay. And do you know ultimately when Mr. Cooley was discharged?
According to this, on the 5th of November.
Okay. And did you see him prior to his being discharged? Him?
The nurse practitioner did. I'm not sure if I followed behind her and actually saw him or not before discharge.
Okay. And who would have made the decision to discharge Mr. Cooley?
We were going by Dr. Nunnery's recommendations as far as his wounds and his repairs, and when he said it was okay, then we authorized the discharge.
Okay. One second. One second for me to find one record. 11:05. Okay. I'm going to ask you to turn, doctor, to a record in Composite Exhibit 1. Which is dated November 5, 2013. Can you take a look at that record and ask me if you recognize that record?
That's a discharge summary.
Okay. And was that record prepared by you?
It was dictated by our nurse practitioner and signed by me.
Okay. And this was prepared at or around the time that Mr. Cooley was seen and about to be discharged on November 5, 2013?
It was dictated on November 6th. So,
Okay. And it was prepared obviously in the regular course of business at Bay Medical Center?
yes,
All right. And in that record, which is your discharge summary, doctor, you note that the plaintiff has a history. Well, you have a section that's titled Discharge Diagnosis. Is that accurate?
yes.
And what does that mean, discharge diagnoses?
Those are the diagnoses that are assigned to the patient upon discharge that were discovered during the course of the admission.
Okay. And I see on this record that at number 4, you note history of daily alcohol consumption. How did you obtain this discharge, or how did you come to this opinion?
I don't remember.
Okay. But a history of daily alcohol consumption clearly means what it says, that Mr. Cooley drank alcohol daily.
That's what that means, yes.
And would you have obtained this information from Mr. Cooley himself, or from another doctor, or from other records? How would you typically come to this diagnosis?
Any of those methods. I don't know how this particular one was arrived at.
Okay. But in this case, or in this instant, you didn't have the opportunity to review medical records of Mr. Cooley prior to him showing up at Bay Medical on November 1, 2013, did you?
No.
Okay, so it's safe to say that this diagnosis would have been formulated either from Mr. Cooley providing you this information, or providing another doctor with that information.
Objection form.
Those would be the two most common ways.
Okay. Would there have been a handwritten note that...
Could I amend that statement to, sometimes we get histories like that from the family, but I don't remember how we got that history in him.
Okay. And would this record, would you have typed up your observations, or I'm sorry, let me rephrase. Would you have done a handwritten note for this discharge day, or would you have otherwise documented your observations and opinions?
Usually there is a note on that day, a progress note, and then the discharge summary is done also.
Okay. You also noted that you also noted under hospital course that Mr. Cooley was started on DT precautions for history of daily alcohol consumption. What does that mean?
DT stands for delirium tremens.
For what?
Delirium tremens,
What does that mean?
that is withdrawal from alcohol in a severe form. I don't see where it says DT, I see where it says DVT.
I'll show you.
Oh, okay.
So can you tell me what you meant by he was also started on DT precautions for history of daily alcohol consumption?
We give certain medications to prevent things like seizures. Usually they're sedative type medications.
And go ahead.
And also some vitamins and things like that. People who are heavy users of alcohol may be deficient in.
Okay. And did you prescribe any medication for delirium tremens? Precautions?
Yes.
And what was that?
If I'm correct, it was Librium primarily. That's what I just saw when I reviewed these. Yeah.
And so do I have it accurate that you prescribed Mr. Cooley Librium in the event that he had any symptoms from alcohol withdrawal?
Yes.
Why would he have alcohol withdrawal? Was he directed to not consume alcohol in connection with the treatment he was receiving for the injury?
Well, you can't drink alcohol in the hospital unless it's prescribed, which is very, very rare.
Okay. Why would you deem it necessary to prescribe Librium to Mr. Cooley while he was hospitalized for this incident?
In the event that he were a chronic alcohol abuser, we wanted to prevent any withdrawal symptoms. We're not always sure of the alcohol history in people that we give that to, but it's better to do it as a precaution than to have somebody go into DTs unnecessarily.
Okay. And did you believe it necessary to prescribe this medication based on Mr. Cooley's blood alcohol level at the time you received the test indicating his level was 0.25?
That level of alcohol is suggestive of a chronic problem, but one reading is not an indication of whether there's chronic use or not.
Okay. So if Mr. Cooley's blood alcohol level was 0.08, well, actually 0.02, which is below the limit that one is deemed legally impaired, would you have thought it necessary to prescribe Librium to that patient?
A lot depends on their history. You know, if you see somebody who comes in with an alcohol level anywhere above 0.00, you know, you think these things, and a lot of time, like I said, it's a precautionary thing.
Okay. So if Mr. Cooley had a test result indicating there was no alcohol in his system, would you have prescribed Librium as a precaution?
The chances are less. However, if, let's say, we talked to him and he said, I drink a pint of whiskey a day, and his family says, no, it's a quart, then, yeah, we probably would have given it to him. It's not just based on one reading.
Okay. So if Mr. Cooley had come in sober with no alcohol in his system and there was no family member, or he did not tell you that he drank a pint or a quart of whiskey or beer, would you have prescribed Librium?
It's doubtful.
Okay. You note also in your discharge record that Mr. Cooley was hemodynamically and neurologically stable. What does that mean?
It means his blood pressure is stable, vital signs are stable. lost my place. He's not having any seizures. He's awake, alert, oriented.
What was the need for the Keflex medication that you prescribed?
To prevent infection of his facial wounds,
Okay. And the Percocet?
pain control.
Okay. And at that point, doctor, did you determine whether or not Mr. Cooley would need to be seen or treated by you any further?
Not by me. He was followed up by Dr. Nunnery.
And you noted that there was no need for him to follow up with you.
Right.
Did you have any occasion to see or treat Mr. Cooley subsequent to November 5th, 2013?
No.
Let me just check. And are all your assessments and opinions with respect to Mr. Cooley that we discussed and as contained in your medical records given to a reasonable degree of medical probability?
Yes.
I don't have any further questions at this time, Doctor.
Dr. Richardson, Jay Manuel, we met just prior to the deposition. I have just a few follow-up questions for you. First of all, with regard to the records, you've been furnished with 2 packages of records. Ms. Smith furnished you with 1 package of records when we got here today, correct?
Correct.
And those are the ones that have the Bates stamp at the bottom of each page.
Yes.
And then you were furnished another pack of records sometime before the deposition by my office, is that correct?
Yes.
You know if that was at the request of your assistant in your office?
It was.
Are the 2 packages of records fairly similar as far as what they contain?
Yes, but there are a few differences.
You didn't see anything nefarious or sneaky going on with what records you've been provided there, did you?
No.
Okay. No attempt to hide records from you that you can tell?
No.
And of course, these records are at the hospital, so you could have gone and gotten a copy for yourself had you had the desire to, right?
Right.
Okay. Regarding the blood alcohol, I see that on the test that we've referred to, it gives the findings as 0.24. I'm sorry, 0.254H. What does the H stand for?
High.
And the over on the right, it says normal range is 0, correct?
Correct.
Okay. And then what is that that measurement over on the far right? Okay. Jeez. says
Grams per deciliter.
grams per deciliter, so that is the way that it's measured?
Yes.
Okay. And is that measurement the same as if someone blew into a breathalyzer machine, say, that a police officer had?
Yes.
And if we look over on, I'm going to give you a Bates stamp number. It's 03302. So it'll be close to the very front of the package you were furnished today. 03302, down towards the bottom. Was this generally just a list of all of the tests that were ordered?
Yes.
And down towards the bottom, is that the alcohol test?
Yes.
Or where it says 16?
Yes.
Okay. And
Where are you looking at?
at the bottom of page 302, number 16.
Oh.
And was this a test ordered by you, or was it ordered by the ER doctor?
According to this, it was ordered by me.
Okay. And I see under that test it says, do not cleanse site with alcohol. What does that mean?
A lot of times when you do a venipuncture, you put a needle into the vein, you clean the site to prevent infection. Sometimes it's done with alcohol, sometimes it's done with other cleansing agents.
What is the reason for not using alcohol? Is it because you might get some alcohol in the test that could give you a false reading on the test?
That's the reasoning, yes.
If someone had a blood alcohol of 0.0254, I mean, that's a pretty high blood alcohol content, as you've said, right?
Yes.
Normally, as a physician, would you be able to tell if someone were intoxicated to that level?
It varies person to person. Some people it's hard to tell. Some people you can obviously tell. Some people you can smell it on. It's highly variable.
In this case, do you know if you were able, or anyone else was able to smell any alcohol on Mr. Cooley?
I don't recall personally, but there's nothing indicated in the record like that.
If someone came in and appeared drunk and appeared to smell and smelled of alcohol, is that the sort of thing that normally a nurse or someone would note in the records?
Usually, yes.
Was a drug screen also ordered at the same time?
A urine drug screen, yes.
And what were the results of the drug screen?
It was all the tests were negative for any drugs that were tested.
When Mr. Cooley first came into the emergency room, was he evaluated by an emergency room doctor?
From what I can tell from the record, yes.
And was that Dr. Fox?
Yes.
Was it Dr. Fox that decided to call you in?
Yes.
And that was because of your specialty in trauma?
Right.
I guess you determined that he didn't need any surgery in his chest or abdomen. Is that generally the kind of surgery that you would have performed?
The abdomen, the chest is usually the cardiothoracic surgeons.
So the concern was with a crush injury like this that he may have had some internal injury.
Yes. That's part of the concern, yeah.
Regarding the potential of alcohol consumption, there was a discussion about taking some preventative measures in case he had some withdrawal symptoms from alcohol. Those were precautionary, right?
Yes, he had no indication of any withdrawal symptoms, but that was started as a precaution.
Right. Based on the concern of his history, that I know it did say in the records that he had a history of drinking alcohol regularly. There's some concern he could have a problem with withdrawal. And you don't want to add sickness on top of sickness. Is that right?
Right. Plus, alcohol withdrawal can in extreme cases be fatal. So
And He didn't have any symptoms, as far as you knew, of alcohol withdrawal while he was in the hospital?
No.
I noticed that the Bay EMS records were a part of the hospital record. Did you have an opportunity to review the EMS records?
Briefly.
Okay. Did they note, any EMS note any symptoms that sounded like seizures or convulsions on the scene?
Do you have a page I could look at?
Let's see if I can find it.
What's that?
It's going to be 324.
They noted that he was neurologically intact.
Three lines from the bottom.
According to the staff at the scene of the injury, I'm assuming that's staff of the place of employment, he was seizing, full body seizure.
So that was not something that EMS actually saw, but something that was reported to them.
That's what I'm reading from this. I can't say for sure what they meant by that.
Referring to your history and physical, what did your physical examination reveal about his shoulder or shoulders?
I believe what his left shoulder appeared to be possibly dislocated.
You know if the x-rays were negative, or would an x-ray show a partial dislocation?
Between an x-ray and a CAT scan of the chest, that's pretty easily picked up, and they did not show that.
Were you aware of the history that he had, that he went on to have a rotator cuff repair afterwards?
No, I'm not.
You've, in describing his injuries, you said he had an avulsion of the ear. What is that?
That's when the ear is completely, I guess in layman's term, cut off from the head.
What, was his ear with him?
Yes.
Did you make any determination as to whether or not the ear could be reattached?
I didn't, but Dr. Nunnery did.
Were you the doctor that decided to call Dr. Nunnery in to address that problem?
Yes.
And is that because he's a plastic surgeon?
Yes.
During his, well, you saw him after Dr. Nunnery did surgery on him, correct?
Mm-hmm.
Do you know what all it was that Dr. Nunnery was able to repair?
He was not able to reattach the ear. He did close the defect where the ear had been taken off, and he repaired lacerations.
And when I ask you about the nasal injury, did Dr. Nunnery provide any care for a nasal fracture?
According to his op note, he splinted, I think he reduced the fracture and splinted it.
And so by a closed repair, that means that he didn't have to make any incisions?
Correct.
Is that basically taking the broken parts and putting them in the correct anatomical position and then splinting it so it can heal?
Yes.
Was Mr. Cooley prescribed pain medication while he was in the hospital?
Yes.
I'm looking at page 349, and it refers to hydromorphone. What kind of medication is that?
That's a very strong pain medicine. Common name is Dilaudid.
And then there's one called alprazolam.
Alprazolam.
Alprazolam. What is that medication?
That's a sedative.
Is it for pain also?
No, more for anxiety. Usually that's what it's used for.
And I see he was prescribed oxycodone. What is
Yes.
that drug for?
That's a pain medicine.
After he was discharged from the hospital, did you have an opportunity to see him again?
Not as far as I know.
Thank you. Those are all the questions I have.
One question, doctor. Why was Mr. Cooley prescribed alprazolam for anxiety?
I don't recall.
Would that have been something he requested or something you would have determined he needed?
Either way, I really don't know what it was in this case. Usually it's because we determine that he needs it, or the patient needs it in general.
How do you determine that a patient needs anxiety medication?
If they're having a lot of anxiety, basically.
And do you determine someone's having anxiety by what they're saying to you, how they look? How do you determine the need to prescribe this
It's-
medication?
A lot of times it's because they complain of being really anxious. They won't be still. They're just, what's the word for it? Very nervous looking.
Okay. All right, I have no further questions. Doctor, you,
Just a little follow-up. Doctor, in your experience, are patients typically nervous or anxious if they've had a part of their body severed, like an ear, for instance?
Frequently.
No more questions.